name's Jennifer, and like many Americans, I am very worried and upset over the Supreme Court's decision to basically enforce the Affordable Health Care Act and, more particularly, the personal mandate where everyone has to have insurance. There are many founded and unfounded fears, and understandably so, given the impact this act has on millions of Americans. So I am committed to starting a YouTube chapter to educate all of us on what the act actually says and to get all of us thinking on the potential ramifications it will have on all of us. I am not an attorney, nor am I attempting to tell you if something is right or wrong. I am attempting to educate only. In this series, I will give portions of the act where you can look it up for yourself and read it. I will attempt to break down what I think the act means and what its possible ramifications are. Remember, though, that each of us has different variables and unique situations, which means to each of us, these sections may mean various things. Again, I only attempt to give you the information and my overall opinion. It is for you and you alone to determine how it will impact you. With that being said, it's probably pretty obvious that I don't support the personal mandate of the act itself to require all American citizens to have insurance. As we proceed through my series, you will understand why. Now, there are portions of the act that I do support, such as the lifetime limits pre-existing conditions language, insurance companies not being able to deny coverage or rescind if you are sick, and for college-bound students to be able to have coverage through their parents' insurance while they're attending school. All of these things I am for. However, again, I am not for the personal mandate. I believe that my health and the health of my family is private and is my business and that of my family's, not the government's. And for something that is so personal, I believe we should have had the right to vote on it individually ourselves. After all, if it's such a great thing, why not give us that personal liberty as is provided for in our Constitution? Instead, we are now going to be forced into a program that the federal government itself already acknowledges will be more expensive than they originally estimated. So it will not be affordable, and one in which they are not even sure will work on such a large scale. I would pose this question. If Europeans and Canadians who currently have governmental health insurance programs in place like their insurance so much, why are so many of these people coming to America to be treated medically? So, let us first start with what the full name of the act is in its entirety. Below you will see the text of the act along with a link that will direct you to the act itself.